Hi, my name is Sunday Adkins. I'm the Clinical Manager Program Coordinator for Way to Success at Midland Memorial Hospital. I'd like to talk to you today about our bariatric weight loss program that we have here at Midland Memorial. Some of the things I'd like to talk about are, what is obesity? Obesity is a disease of excess fat storage with a number of associated diseases that we typically refer to as comorbidities. What does comorbidities mean? Comorbidities are health-related issues that you have that you typically wouldn't have if you didn't have the obesity. So in taking care of the obesity and losing the weight, typically most patients are able to get rid of some of those other health-related issues. Obesity is multifactorial. There's many things that contribute to a person being obese. It's usually lifelong. It's progressive, meaning it starts at whatever age. And because losing weight is so hard, most patients from that point struggle with that weight gain and continue to gain weight over their lifetime. It is potentially life-threatening, especially when you add in those other health-related issues that can be brought about by the obesity. And it's extremely costly in so many areas, such as multiple doctor's appointments, multiple prescriptions that patients are on, travel-related expenses that can be contributed to by a patient's extended size. Then we talk about, what is morbid obesity? Usually, with morbid obesity, that's defined as being more than 100 pounds overweight or having a BMI, which is body mass index, that's greater than 40. The body mass index actually comes from the National Institute of Health, and it's based on a formula on looking at a person's height and their weight, and then they come up with a percentage. So an acceptable range for body mass index is 18.5 to 24.9, and that body mass index can actually go all the way up to the category of being considered super morbid obese, which would be a BMI of greater than 50. There are many factors that contribute to obesity. It can be behavioral, it can be genetic, it can be environmental. In today's society, we all like to go out and eat and socialize and be around our friends and our family. But the portion size that gets served today, either at those family gatherings or when we go out to a restaurant, are way larger than what any of us actually need to consume. And it's easy to sit down in one setting and consume 2,000 plus calories, when in reality, probably none of us for the entire day need to go over about 1,200 to 1,500 calories. Going back to the serious illnesses that can be brought about by obesity, you have things like type 2 diabetes and all the complications that can come around with type 2 diabetes. Have high blood pressure, high cholesterol, sleep apnea. For the females of childbearing age, you have infertility issues, and that woman can struggle wanting to have children, wanting to have a family, but due to the obesity, it's absolutely impossible. So having weight loss surgery and getting rid of the obesity can help fix all of those issues. It's easy to feel like you're the only one that's dealing with the obesity. You're the only one that's overweight. And the fact is, you're not alone. More than 65% of adults in the United States are overweight or obese. Sadly enough, 32% of children these days are overweight. That's contributed greatly to that lifestyle that we typically live today, where children are not as active as what they used to be. Everybody has electronic devices. So children don't go out to play as much anymore. They sit around and play their games, and they're on their iPads or laptops or whatever that they may have, and that decrease in activity with an excess of calories contributes to that 32% of them being overweight. As far as the medical cost related to obesity, the medical cost for the year 2018 was over $210 billion that it cost. The heartbreaking statistic about obesity is that every year there's over 325,000 people that die because of the complications and health issues related to obesity. The The daily challenges of obesity can be the joint pain that make it so incredibly hard just to get around and do activities of daily living, much less going out and doing anything fun with your family or with your friends. If you feel like pursuing bariatric surgery sounds like a good idea for you, but you're wondering, am I even a candidate for weight loss surgery? Let's talk about that for a moment. Insurance companies, most of them will pay for bariatric surgery as long as a patient meets that criteria. To be able to meet criteria, most insurance companies base that off of a patient's body mass index. If a patient is fortunate enough to be overweight but has no health-related issues, their BMI needs to be 40 or above. If they do have health-related issues, then their BMI needs to be 35 or above. We do like for the patients to be healthy enough to undergo a major surgery. We would like for a patient to understand the risk and the benefits of having bariatric surgery. That is something that when a patient goes in for their surgical consult with one of our bariatric surgeons, the bariatric surgeon with the patient will have a discussion over the patient's age, their health risk, the amount of weight that they're wanting to lose to reach their goal, what their lifestyle is all about, how do they typically eat, what do they typically eat, how active are they in their everyday life. And together with the bariatric surgeon and that potential patient, they will come to an understanding of which one is going to be the best procedure for that patient to make sure that they're going to be as healthy as possible and have the best outcome that they can possibly have. Bariatric surgery is providing the patient with the tool that they need to be able to be successful in losing weight. And as we all know, losing weight is extremely hard to do. So having that tool can help that patient to be able to reach the goals that they haven't been able to reach in the past. It can actually help to change their life. It decreases their mortality risk. It reduces their having to use health care. It reduces the risk of having to be on multiple medications. Insurance companies, we will work with your insurance company. We will provide the documentation to them that we know that is required so that we can get insurance approval potentially to be able to cover part of the cost of having bariatric surgery. There are risks involved with having any type of major surgery, and that's something that the patient, as I said, will discuss at the time of their consult with our surgeon so that they understand what those risks are and are well able to move forward with their decision to have bariatric surgery with that knowledge. We offer 2 surgical procedures. We offer the laparoscopic sleeve gastrectomy. With the laparoscopic sleeve gastrectomy, what we're actually doing is going in and making a portion of the patient's stomach much smaller. And making their stomach much smaller, that patient is able to eat, for the most part, the same foods that they eat every day right now, but they're eating a considerable amount less so that they're able to lose weight. But with the way the surgery works, they are still able to get that sense of fullness. So they eat less, they still feel satisfied and full, so they don't get discouraged, and they're able to lose weight. We also offer the laparoscopic gastric bypass. With the gastric bypass, it's very similar to the sleeve, but there's actually 2 parts that go along with the bypass. We are still going in and making the stomach a lot smaller, but we also go in and we're bypassing, hence the name of the procedure of it being a bypass. We're actually going in and bypassing the first 150 centimeters of the small intestine. By doing that, whatever the person eats, which is going to be considerably less, your body is only able to absorb about 50% of what you do eat. So the difference between the 2 as far as results, typically with the bypass, most patients are going to lose around 75% of their excess body weight. Whereas with the sleeve, a patient should be expected to lose approximately 65% of their excess weight. Either one of the procedures are wonderful tools to help a patient to be able to be successful in losing weight and to resolve some of those health-related issues. Take diabetes for a perfect example. Typically with either one of these procedures and losing the weight, a person is able to either greatly improve their diabetes overall, and a lot of our patients are actually able to go back later and be diabetic free, which would be great for a patient not to have to do those frequent finger sticks, not to have to worry about taking insulin, and again, just all the complications that can come with having diabetes. When we talk about either one of the procedures, then we say that we offer those laparoscopically. The difference between laparoscopic versus the old way of doing surgeries is with old surgeries, you had a large incision that typically went all the way down your abdominal wall, and recovery time was very long and can be a lot more painful. With laparoscopic surgery, we actually go in and we make 5 to 7 small incisions that are about 1/2 inch long in length. So with that, the recovery time for a post-op patient with either one of the procedures is greatly reduced. The pain after surgery is greatly reduced. And we also do give a prescription for pain medication when a patient goes home, although most patients, because of having it performed laparoscopically, typically need little to no pain medication afterwards. A lot of patients ask recovery time, what's the difference between a sleeve or a bypass? Or their nutritional needs, their diet, what they're able to eat and drink. How is that different between the two procedures? And I can tell you, with either one of the procedures, the diet is going to be the same. Recovery time is going to be roughly the same. One difference is going to be your hospital stay. With a sleeve procedure, typically you're going to spend 1 night in the hospital, and with the bypass, you're going to spend 2 nights in the hospital. So that's kind of some of the differences between the two procedures. But either one, as I said, are great tools for helping a patient to be able to lose that weight and to start that journey to improving all their other health-related issues and getting healthy and getting their life back, which can make a huge difference to patients. So we are here with the comprehensive team that we offer through our program. We are with our patients from day one. So from here getting this information about what we have to offer all the way through to you being a lifetime patient with us. Myself as the coordinator, I help to work with you as far as getting your surgical consult coordinated, getting you with our psychologist to talk to you about your expectations and how realistic your goals and your plans are, to our nutritionalist that will work with you to help you to relearn how to eat healthier to help you to reach your goals. We are with you every step of the way. Myself, I'm on call 24/7, 365. So at any time and point, any of our patients have any concerns, any questions, any needs, that's something that's pretty unique to our program. You're not having to call into a voicemail service and hope that someone will call you back. You have that support for you at all times whenever you need it. And we have a great team that works together to make sure that our patients are taken care of and to help you to reach your goals. So we truly offer, like I said, a comprehensive program to help you to meet your goals and to get where you want to be. And we would absolutely love to be able to talk to you, to answer any of your questions, and to help you to get started on this journey to losing weight and to getting healthy. You can contact me at 432-638-8081.